Hello, I am Professor Jean-Charles Deybach. As you probably know, acute intermittent porphyria is a rare autosomal dominant genetic disorder of heme biosynthesis that results in neurovisceral attacks occurring mostly in women. The most common manifestation is severe abdominal pain, mimicking a surgical emergency. Tachycardia, hypertension, and sweating are often present, and neuropsychiatric manifestation can include anxiety, agitation, hallucination, and even severe psychiatric condition. A real-life severe case of acute intermittent porphyria involving a 26-year-old woman that seemed to present with Guillain-Barré syndrome was published in the journal Intensive Care Medicine in 2012. The patient presented with severe acute abdominal pain, and she underwent an appendicectomy. After the surgery, peripheral neuropathy developed in the lower limbs. The neuropathy worsened within a few days and led to respiratory failure. The patient therefore was admitted to intensive care unit for mechanical ventilation. So the patient displayed proximal weakness and hypoesthesia, facial dysplasia, and a lack of tendon reflexes. She also experienced blurred vision, hallucination, and seizures. Finding of hypertension, sphincter dysfunction, and severe gastroparesis were initially thought to be due to dysautonomia. The cerebrospinal fluid assessment was normal, but electromyography showed acute motor axonal neuropathy. Blood chemistry revealed hyponatremia and persistent acute renal failure despite rehydration. So as the patient displayed several atypical features of Guillain-Barré syndrome, an alternative underlying condition was therefore suspected. Acute intermittent porphyria was eventually confirmed by a change in urine color when exposed to light and high porphobilinogen levels found in urine. This diagnosis was significantly delayed. The patient required then prolonged treatment with humanimine because recurrent pulmonary infections worsened her AIP condition. She underwent a tracheotomy for more than 6 months of mechanical ventilation, as well as a genulostomy for nutrition. At the time of the publication, the patient was recovering in a rehabilitation center. To conclude, and as a take-home message, acute intermittent porphyria should be suspected in young women who present with acute motor axonal neuropathy associated with severe abdominal pain. The diagnosis of acute intermittent porphyria AIP is simple and cost-effective. Urinary porphobilinogen (PBG) levels should be routinely measured in patients with axonal Guillain-Barré syndrome. And it is to note that high level of porphobilinogen in urine is pathognomonic of acute porphyria. Thank you.